Today we have the honor to have with us the current president of EMA, Dr. Vincenzo Costigliola. He graduated in medicine from the University of Naples and anesthesiology and intensive care from the University of Pisa. Also attended several postgraduate studies. He was the chief of medical services in the Italian Navy. He had responsibility of the outpatients clinic of the Shape Hospital in Belgium. Is a consultant for NATO in Brussels, the Western European Union, and our embassy. And as said, is the current president of EMA, the European Medical Association, and the president of EDA, the European Depression Association. Thank you to be with us today. We would like to understand the reasons, the features of travel medicine, including why we need it, the travel.
Thank you very much. Thank you very much. It's certainly a pleasure to talk with you and to develop this aspect. The important today, the medicine is everywhere. We need to have the clear criteria in the selection, and we need to have the clear criteria if we talk about the travel medicine. What we want. The medicine is not only fixed in one place, but is all around. The medicine is everywhere, and the best approach is to have the common response to the different queries. In which area you are especially interested? Because when we talk about the travel medicine, we talk about the immunization, we talk about the prevention, and so on. Tell me.
Well, of course, because of the moment that we are living today, we would like to know more from you, from an expert, what we can do to prevent illnesses while we travel.
Yeah, you know, the prevention is the best. The prevention is the information. We need to give the right information at the right moment, at the right person. We are now submitted to the different items, to the different input come from the different sources. We have the different sources from the media, from the come with the different information. I insist we need the clear, simple, and documented information from validated sources. In this case, especially, it's important to know what is the epidemiology, what is the risk, how we prevent the illness, what is the best prevention. In this case, is the vaccine, of course, and the measures we have to use: the mask, the wash the hand, and the distance. Each single situation needs the specific protocol.
Thank you very much.
Good afternoon, Dr. Costigliola. Before we continue with the second and last question, I'd like to introduce myself to you. My name is Dario Romano, and I'm attending the first year of Medicine and Surgery. Nice to meet you.
It's my pleasure.
The second and last question that we wanted to submit to you was that EMA is working in the field of postgraduate education and international cooperation for refugees. Can you please tell us of some of them?
Listen, the EMA is really the professional association. The idea is to reproduce in Europe what is done already in the States with the American Medical Association. The difference is in the States, we have only one country with one money, with one language, and in Europe, still now we are 27 different cultural background, the 27 languages, and so on. To be international means to have the same objective, to go in the same direction. This is important. About the refugees, of course, it's an important thing. We have the refugees comes to Europe, and in the world there are a lot of situations similar like the Rohingya in Bangladesh. This is a specific condition of the refugees. what they need. They need to be accepted, they need to be treated, cured, and examined. Is the social responsibility. And when we use the word social, it means the money. We need to invest the money for this population. This is very important. And this is not more a medical approach, but it's the social and political approach. We as a doctor are interested to save the life. We are interested to prevent the infection. We are interested in treating the patient with illness.
Well, I think we will all agree to thank Dr. Costigliola for taking the time out to see us. It is always a pleasure for us students to be able to compare ourselves with professionals in the sector. Have a good day.
Very good. Thank you very much. But once more, you are the future. Think about. You have to think now what will be realized tomorrow. Okay? Good luck.
Okay.
Thank you very much for this conversation.